I'd like to take just 5 minutes of your time because I know I'm standing between you and lunch and whatever else you need to do this afternoon. For those of you who don't know me, I'm Tom Diano. I'm Executive Vice Dean at the Mailman School of Public Health at Columbia University. And I'd say more importantly, for the last 30 years, I've been teaching and doing research in healthcare management. And I'm lucky enough to have been invited by Ray to collaborate on this project. And I want to thank him and his colleagues for lining up what I think are 4 outstanding speakers. I was riveted the whole time for different reasons about their insights and their arguments that they brought today. So I have 5 or 4 actually quick observations and a few things I'd like just to emphasize from what the speaker said. It seems to me, and maybe I'm guilty of being more of a lumper than a splitter, but it seems to me that there's actually a fair amount of agreement about what needs to be done. And in fact, as Michael just pointed out, there's actually been a fair amount of agreement about what needs to be done for a long time. What I worry about is implementation, how to get things done. The more that we emphasize the what, I worry about we need equal emphasis or more emphasis on the how to implement, how to build integrated delivery systems, how to get more teamwork, how to change our educational institutions. The how questions I think are tougher to tackle, and that's why they get deferred. It seems to me that if we want to put the leadership in our leadership enterprise here, this is where the role of leadership matters so much. And it's probably not a mistake after listening to Michael for the first time. I'm relatively new to New York, but my impressions over the last couple of years that I've been here is that his organization is the leading organization, and it may be because it has the best leader. I think that we need to emphasize more the role of local leadership and management, plain old good-fashioned management as well as leadership, in making implementation happen and happen well at the local level. Because in the end, as was emphasized quite a few times, all healthcare is really local. So if I would put any plug, I would say, where are the leaders and managers that we need to make this happen? The other thing I think is remarkable about all 4 speakers, and certainly Michael, who's still with us, I think, and that is their ability to do what psychologists call perspective taking versus politics. It's true that we had some folks who may identify themselves as Republicans and Democrats and from this policy angle or that. But at the end of the day, I'm more struck by the strength of their analysis, which in some sense crosses ideological grounds, and more than I am by the strength of any ideology that they bring to bear. A lot of the what is determined really, I think, by good old pragmatism. And I think that getting things done on the ground needs to take the same perspective. One thing I do worry about, and Michael emphasized this, is that I think there's a bit of a chill for entrepreneurs and investors in the room. There feels a little bit of a chill to me that's coming from uncertainty over the next couple of years. I agree again with Michael that we need innovation, innovation, and innovation. We need it in ways that we haven't perhaps had it before. Not in the pharmaceutical industry, not in the medical device industry, not in the high-tech end, but on what I would call the low-tech end of this implementation theme that I'm sort of banging on. I'm worried about, will there be investors there? Will there be entrepreneurs there? Will there be too much uncertainty for them to overcome to get excited about moving into this space? I hope that doesn't happen. I think it would be a large loss for our country if it does. And the last thing, coming from a school of public health, I cannot help but emphasize again, as have some of the speakers and especially Michael, that healthcare systems don't make us healthy. The only thing that really makes us healthy is prevention and lifestyle. And I think until we wake up to that fact, spending a lot of time on policy analysis is not really going to help us. I certainly agree that costs are not going down anytime soon. The real issues that we need to face as a society are the ones that have been mentioned. They're the lifestyle issues, they're prevention issues, and I wish coming from a school of public health I had more answers for you, more empirically based answers for what works on prevention and health promotion. I don't, but I think we need to invest in it. I would argue that we need to invest more in trying to understand and learn how to do health promotion, how to do prevention, how to keep our society healthy, because there's no way really that costs are going to go down or quality is going to go up, in my view, without a heavy dose of prevention and societal approach to taking responsibility for our health. And I'll leave you on that note. I thank you again for your participation, for being strong and sticking with us all morning, and I thank again my colleagues in making this effective. I look forward to working with you on healthcare and issues of health over the next several years. Thank you.